Sparks of Change webinar. My name is Lindsay Graham and I have a long-standing interest in food insecurity, inequality and poverty in Scotland and beyond. I'll be your chair for today, and you'll also hear from our events manager during proceedings, Amanda Cameron, who will be managing our IT and helping with today's Q&A slot towards the end of the session. To tag proceedings in social media, please use #SparksofChange so that others can follow along. It's good to see the enthusiasm for today's event, especially when you're taking a couple of hours out of your busy schedule, so we appreciate you being here. Your mics will be on mute until the Q&A session. May I ask you please to introduce yourselves in the chat to say who you are and where you're from. Also, because today is very much about partnership working and sharing practice, I would encourage you to post in the chat any links to useful reports, websites, research, funding opportunities that you think may be useful to others. So if something sparks in your head while listening to our presenters, please do share your thoughts or links in the chat. We have no break in the proceedings scheduled, and I would ask you to please keep your questions to the end of the session. Given that we have a new central government administration which has seen cuts and more to come across our benefit system, particularly given Tuesday's news and the publication of Pathways to Work Green Paper consultation, which closes on the 30th of June, worth a read if you haven't yet seen it, on its approaches around reform to the health and disability benefit system and employment support. As yet, it's not clear how these changes will affect the devolved nations, so we have some difficult times ahead where joint working and sharing of resources will be ever more important to address poverty in our communities. With poverty in Scotland still a challenge, and with the media picking up on issues ranging from emergency access to infant formula to cuts in the winter fuel allowance, it is affecting all ages and stages of the life of our citizens. So today is a timely event and hopefully an insightful reminder of some of the amazing good frontline work that is happening across our communities. And I'm privileged to be able to introduce you to our 6 speakers this afternoon. You're going to hear first from Ian Snedden, who's the Research and Information Officer for Moray Council, who's going to give you an overview of poverty in Moray. You will also hear from Annie Mack, who I know from Broken Up Broken, the anti-poverty charity in Kinross. She's also the Development Officer for Poverty Alliance, who's going to talk about experts by experience and rurality. Some interesting stuff there. Amanda Olsen, who's the Business Development Manager for Active Communities in Renfrewshire, who is going to cover tackling health inequalities. Sadly, Amanda has to dash off, but if we have a few moments, we might be able to take a question at the end of her slot. Otherwise, if you have any questions for Amanda, please pop them in the chat and we'll try to follow up with them later. Then we've got Maggie Hepburn, who's the Chief Executive Officer of Aberdeen Council for Voluntary Organisations, a Third Sector Interface, who's going to talk about cash first funding for men. That should be interesting. David Kidd, who is the Head of Policy and Engagement from the Scottish Association of Care and Resettlement of Offenders, will tell us about lived experience and how it shapes policy and practice. And then we've got Caroline Doyle, who's the Anti-Poverty Development Officer with West Lothian Council, who will talk to us about financial advice in the education setting. I just want to remind you that this event is being recorded, so you may wish to switch your cameras on or off as you see fit. For those of you who have your pens poised, you'll be good to know that you'll be able to see the points you might have missed in the catch-up. Also, any questions you have during the final session that remain unanswered will be followed up by contacting Moray Food Plus post-event. So we'll post a link to the chat, a link to that in the chat at the end. So without further delay, I'm going to ask Ian to open up with his presentation. Over to you, Ian.
If I get the right one, here we go. Hopefully this is the right one you can see. Yep, that looks right. So there isn't a distinct, good afternoon everyone, there's a distinct advantage of going first. Everything can only get better, and you might forget your questions by the time we get to the question and answer session. I'm not going to introduce myself because that's my name on the screen there, and I am going to take you through a whistle-stop tour of what poverty looks like in Moray. So without further ado, I'll skip on to the next slide. So what do we mean when we talk about poverty? Well, relative poverty has a definition. It can be seen as quite confusing. And you'll see there, it's a proportion of children living in households with equivalised incomes below 60% of the median UK income in the current financial year after housing costs. The difficulty there is children. We see children differently. Some people see children 0 to 15, some see 0 to 17, but for the purpose of poverty, it's a bit more complicated than that. So you have children aged 0 to 15, and those 16 to 19 if they're in full-time, non-advanced education or training. If you know what that is, ask me the question at the end, because I don't want to go into depth now. So we're going to look at, very quickly, the background of the data and the common factors, how Scotland compares UK-wide, how Moray compares in Scotland, how the data was analysed locally, significant changes 22 to 23, and can poverty be eradicated? So the common factors, we've got 59% of Moray's population live in urban areas. We've got 66 of Moray children in relative poverty live in urban areas. National data, it's very limited. When you get national data, especially poverty data, it's produced generally by local authority level. Beyond that, the End-Child Poverty Group through Loughborough University used to produce it by political ward, and they used to produce it by country. They've stopped doing that. The fortunate thing about national poverty data is it doesn't tell you anything within an area, whereas localised data is rich and it enables the building of pictures within the areas of Moray. This is not rocket science, this one, and forgive me if it sounds a bit condescending. Poverty is income related. The less you have, the higher the probability of being in poverty. Less income equals less likelihood of being a property owner, which equals poverty levels significantly higher in social housing. And a higher proportion of social housing and a higher proportion of people on lower incomes in urban areas. And then you have a higher proportion of young and single parent families in social housing and in urban areas. So moving on, how we compare UK-wide. I've got down here 21 to 22 and the trend between 2014 and the change between 2014 and 2022. United Kingdom as a whole, there was 29.2% of children lived in relative poverty, and that had gone up 1.9% in those 8 years. England, may be surprising to some, but certainly not surprising to others, has the highest poverty level in the UK, almost 1 in 3 children, and it's up by 3%. Now, Scotland's actually relatively quite low in comparison to those two figures you see above it, but the frightening thing is it has risen by 3.5% in that period of time. Wales is still higher than Scotland, but it has dropped. And Northern Ireland is the lowest of them all, and it also has dropped over that period of time. So there's it's just a graph that shows you where we've come from, Scotland being the red one, right at the very bottom in 2013-14, and we're now above Northern Ireland. But it does seem to have plateaued, and the latest data that's released later part of last year indicated poverty had fallen by 0.2% in Moray between 2022 and 2023. But how do we look? How does Moray compare Scotland-wise? Well, we have a family group. Now, for those of you who don't know, every local authority has comparator local authorities. So Moray has 7 comparator authorities, and they're authorities that are relatively similar in either population, geographics, urban, rural kind of divide. So Moray has a poverty rate of 24.1%, which has increased by 3.2% over that period of time. And our family group average is actually lower than Moray, and it hasn't increased by the same level. So in 2014-15, the green bar shows Moray. The ones that are like a light kind of orangey colour are our comparator authorities. The red line being the average in Scotland at that point, and then we have, you see that five of our local authorities, our comparator authorities, had higher levels of poverty than us in 2014. However, we skip forward to 2021-22, there is only one comparator authority that has a higher level of poverty, and it literally is 0.1%. So there's where we came from, 2014, and the green bar is where we are now. So it's quite a distance to travel. We are now kind of just high end of mid-table compared to where we were before, was the much lower down the echelons of poverty. So how the data was analysed locally. Well, national data is produced and it tends to be maybe 18 months behind. So the beauty of localised data is that it tends to be more current. So I used 20 localised and 4 local authority level data sets. Now the localised ones were either internal within the council or provided by Moray Food Plus, which was a particularly rich data set, and DWP. DWP produced statistics that are down to very small areas called output areas. So that data can then be built up. Fortunately, I can collect data within the council and from Moray Food Plus at postcode level. So the smaller the geography allows me to build it up into bigger areas. And what we did was we looked at output area data zone level, but the data was then factored to data zone level. So for those of you who don't know, geographies in Scotland tend to be, you've got Scotland as a whole, then you have 32 local authorities. And within every local authority, they have what they call output areas. In Moray, there's 770 of them at the moment. So they're small geographies. Data zones, we have 126. So they're slightly bigger geographies of around about 750 people. And then, oh, I'm hearing somebody. No. So when you work with small geographies, it can tell you a bit more about localized area than it can do if you're looking at just a local authority as a whole. So each field that was collected, and I think there was in excess of, although there was 20 data sets and 4 national data sets, it gave me around about 50 to 55 different fields that I could then look at ranking. And I ranked every field between 1 and 126, which equivalent to the data zones in Moray. Then it was factored to intermediate zone level, which is, we have 24 intermediate zones in Moray, slightly bigger geographies. And then every field was ranked. So, it was aggregated to determine the overall ranking score of the particular intermediate zone. And it created a financial, what I call the financial vulnerability index. Because I wouldn't like, poverty is a separate issue. Poverty tends to be more calculated from children in low-income families data, and an algorithm is applied to that. So, like I said, the poverty, I didn't include poverty as a calculation. It's included as a separate entity. What I created was basically a vulnerability index for every intermediate zone and data zone in Moray. So this is just a small example taken from my monstrous spreadsheet, and it gives you 4 data zones there, where they are within. We split things up in Moray into associated school groups, which we have 8 of in Moray. So that's what they are. Then we have the population of that data zone, the number of households in that data zone, and the data there is from Moray Food Plus, and it shows the number of people they supported in that period of time. The proportion of people supported. Now, the proportion is an important thing because numbers don't mean a great deal when you have areas that are bigger than others. So you can see from the population of the bottom one there, they have a population of almost twice that of Elgin Cathedral to Ashgrove. So that's why proportions are so important. And then the ranking comes after that. So you can see for those examples there, you'll see the ranking themselves. So moving on, very crude picture of Moray. So I looked at identifying the 10.
5-minute warning there.
Okay, you've got 10 intermediate zones of account for 57% of the children estimated to be living in poverty. And these are hotspots in Moray. Probably not surprising that you've got Lossiemouth, you've got Forest, major ones in Elgin, Keith, round about the Fochabers area, and Buckie as well. So there's you'll see the difference in the numbers. The blue numbers are the estimated number of children living in poverty. You see Elgin Cathedral Ash Grove, it's, you know, it's 40%. That's 4 in 10 children. New Elgin East comes after that. Forest South West and Manachey, Buckie Central East. And there where you see the difference in my calculations and the estimated poverty in that area. See, number 5 has a higher poverty level than number 4 there, but my index showed that Buckie Central East was actually more vulnerable than Keith and Fife Keith. Elgin, Bishop Mill, Lady Hill. Some of these names will be familiar to some people. Some of them might be a surprise. But there we go. There's the 10 there. But the top 5 alone account for 1/3 of children in relative poverty in Moray. So 1/3 of children live in 20% of Moray. That's quite significant. And what I looked at also is that, just out of interest, I looked at mapping the looked after children, the hotspots have looked after children within Moray, to see if there was any correlation. And to a great extent, there tends to be a lot of correlation. So we're looking at the significant changes. And the worrying thing for me is that from the least vulnerable to the most vulnerable in 2021-22, there was a gap of 25%, between 9 and 36%. Now that gap has widened and it's now 34%, which shows for the least financially vulnerable, levels have improved, and for the most vulnerable levels, vulnerability levels have worsened. 9 of the top 10 remain in the top 10, not all on the same ranking. I'll let you quickly read through these rather than me read them all out. And then there's a couple of slides at the very end that if we get a chance to run through, we'll run through. And it's just about the important one to remember that people criticise SIMD. SIMD, the Scottish Index of Multiple Deprivation, they say it can't be applied to rural areas as well as it can be applied to urban areas. But the data I compiled actually showed there is a lot of similarities, especially in deciles 1 to 4 and 9 and 10. What we're going to look at, if it was move on, there we go. Can poverty be eradicated? Well, the good thing is that all 4 UK nations measure poverty the same way, and it's based on income. There's a downside to that, because if you're looking at are the targets achievable, the Scottish Government targets, are they really achievable? What level of poverty is tolerable? What's the difference between mitigate and eradicate? And using the current measure, what needs to happen to eradicate poverty? Now, this is an example there. I plotted incomes from £12,000 to £250,000, and that equates to 999 households. It is fictitious, but bear with me and I'll show you what needs to change. That's the current picture at the moment, the median being 34,500 for a median household income, 49.9% above that and 49.9% below that. So 60% below, okay, no problem. 60% below that is the red houses you see there. So that income is £20,700. If we apply a blanket 10% increase, nothing changes. The median, although the value increases, the number of people and the number of households doesn't change. So applying a 10% increase in income across the spectrum makes no difference at all. If we apply a 10% down below, 5% in the middle, and 2% increase, poverty does decrease, but we're still at 16.7%. So we're not really eradicating it. We've reduced it, but we haven't eradicated. And bear in mind, 10%, 5%, and 2%, not really realistic increases in salary. 10%, 2%, and 0%. So that doesn't make a great deal of difference either. 16%. 20% down below, with no increases elsewhere, does reduce it, but I mean, we're getting into unrealistic territory here. How often will you get a 20% increase in income? Now, if we reduce it, if we increase the bottom, the ones below 60% by 50%, you've almost eradicated it, but not quite. But however, if you increase the bottom by 100%, it actually has the opposite effect, because now what you've done is you've dumped some of the ones that were in that blue zone into the red zone, and some of the red zone into the blue zone. So it is so difficult to eradicate poverty based on the measure we currently use. So there we go.
Unfortunately,
There's how we
time.
eradicate it. Perfect. And my next slide was questions. So I've managed to get there. Apologies for being a whistle-stop tour, but if you do have any questions, there will be there's a slot at the end. So I appreciate you listening to me, whether it was a ramble or not, but thank you very much, all of you. And I will stop sharing my screen.
Thank you very much, Ian. A lot of information there about data, local and national, and some good points on can poverty be eradicated. Our next speaker is Annie McCormack. Annie's going to talk to us about experts by experience and rurality. Hopefully you can start sharing your screen next. Annie, look forward to hearing what you have to say.
Thanks so much, Lindsay. Yeah, I think I've just pushed Ian out of the way. I'm so sorry, I feel a bit rude.
No, absolutely.
So I'm just going to increase my screen size so that you can all see it in its glory. My name is Annie McCormack. I'm a development officer at the Poverty Alliance, and I'm working on a 3-year project with them on taking action on rural poverty in Aberdeenshire, so just across the border. And we're also have a parallel project happening in Argyll and Bute. This is funded by the Robertson Trust. But just to let you know, if you don't know who the Poverty Alliance are, we're a network of organisations across Scotland. We're Scotland's anti-poverty network. And our purpose is to reduce and prevent poverty. And we do this in lots of different ways, including looking at opportunities to increase adequate incomes for people on a low income and reducing their costs, ensuring that people have access to high quality services, increasing public support through campaigns and other work, and giving people a better opportunity to participate in the decisions and policies that affect them the most. The Poverty Alliance come from a point where we understand that the fundamental causes of poverty are structural in nature rather than down to the behaviour of the individual. A structural understanding of poverty looks at poverty as a consequence of the economic, political and social forces that exist outside the immediate control of the individuals. And again, as Lindsay mentioned at the start, we've seen this week decisions being made that are going to impact people on disability benefits, and again, that's outside of their control. So those structural issues can also include things like labour market policies, economic systems that favour the rich at the expense of the poor and drives gaps in income inequality, housing costs that leave working households with nothing left to feed their families, or social structures that exclude certain communities from accessing the same opportunities that other people might take for granted. So if we think about levers to challenging poverty, tackling poverty and eradicating poverty, we see participation as a key lever to preventing and reducing poverty alongside things like access to a fair wage, adequate human rights provisions, and an effective social security safety net that works for all of us and enables households to live a dignified life. So how does that look? So if we're thinking about human rights, for example, taking a human rights-based approach is about making sure that people's rights are put at the very centre of policies and practices. And we use the panel principles as one way of breaking down what that means in practice. And obviously we're focusing on participation. Everyone has the right to participate and have their voices heard in decisions which may affect them. And we know that not being heard means not being served in that space. Participation should be inclusive and it should be accessible. We need to go where people are instead of waiting for them to come to us. We need to think about what barriers are stopping people from getting involved, sharing their stories to add to the things like what Ian was talking about in terms of that data, and then thinking about how do we take action to remove those barriers for people. And that can be things like covering costs and expenses, ensuring information is available and accessible, and wherever we meet is accessible. Participation needs to be meaningful, not tokenistic. And we know that people with lived experience of living on a low income should be involved in setting the agenda and be equal partners throughout any process. There are different types of participation, and we look at this ladder of participation as a way of helping us and also challenging us when we're thinking about how we're building participation into our work. We're also warned that participation without power is manipulation, and it's a frustrating and empty experience. So we want opportunities for participation to not be one-off, not be tokenistic, not be tick box. It has to be about building relationships with people. People are wise to this now, so we know that there's consultation fatigue. We often hear people saying, how often do you want us to tell you the same thing? And also having a process where people will tell you what they think you need to hear, and it goes into a vacuum and they don't hear anything else back from that, which is really challenging. So before embarking on any recruitment to a lived experience panel or process, first of all, we need to think about why are we doing it? What is it that you want to get out of this process? But also of equal importance, what will the participants want to get out of it? As an anti-poverty approach, any interventions need to be as effective as possible. It boosts efficacy and it makes every pound invested work as hard as it can. When it comes to fighting poverty, people with lived experience are essential teammates if we want to maximise the impact of any anti-poverty work. So when we think about things like other processes that are happening around the country, I look at End Poverty Edinburgh, a fantastic group of people that Poverty Alliance facilitates, and they work with City of Edinburgh Council. When we spoke to one of the participants, they said, when people ask me what I do, I say End Poverty Edinburgh, and it gives me purpose. And equally, City of Edinburgh Council said that having a voice like End Poverty Edinburgh is vital for tackling poverty. So both parties need to get as much out of this as the other. And then we think about the how. So in terms of rural spaces, we need to think about what logistics work for everybody taking part. We need to make sure people can get online, or would they rather meet in person? How often would they like to meet? What time works for them? It is a logistics effort in the beginning, but also thinking about how something like this is resourced, and that needs to be things like including your budget and your staff time. It needs to be making sure that people are paid for their time and that their time is valued. Dedicating one staff member as one point of contact, and that staff member has flexible working hours, because maybe these sessions can only happen in the evenings. Making sure that there's digital access. And that's incredibly important in a rural space where lots of people find having digital access a challenge, as well as phone signal being a challenge. And also building in respect. So respecting people's time, respecting people's stories, respecting their trauma, and respecting their expertise. We talk a lot about sharing your experience, not your opinion. In our panels, and that's a really great way of developing that trust and building those relationships. We work we spend time at the beginning of sessions working on our working together agreements, and that talks about how we work well together, but also about how we disagree well. We're not always going to agree, and how we're respectful when we do that. Avoiding one-off situations that I've mentioned before, and building those long-standing relationships. And communication is key. It's two-way communication, and that includes feeding back. And sometimes that's like, we tried this, we haven't heard anything back. That's what we're letting you know. Or we can't do this because XYZ. We also need to build in things like avoiding assumptions, which is really crucial, and managing people's expectations.
Just to let you know, Annie, that's 5 minutes.
Ah, cracky. Okay, thank you. Why do we need to focus on rural poverty? So we know, and I'm one of those people that Ian talked about there, that historically poverty has been framed as a predominantly urban issue, which has resulted in rural poverty being met with inadequate policy responses. People living rurally and on a low income are faced with both the poverty premium as well as the rural premium. So we know that there's a higher cost of living in a rural place, between 15 and 32% higher than in urban parts of the UK. And that, sorry, Ian, income-based measures of poverty don't account for this higher cost of living. So the SIMD data does focus on income, but it doesn't include the higher cost of living in rural areas. And measures of deprivation struggle to detect those dispersed pockets of deprivation that are found in rural areas. And the rural idyll masks the reality of rural living for many people, and stigma and shame in small rural communities where poverty and affluence live side by side are barriers to accessing support. So our approach, we're by no means perfect. We have an annual review of our participation policies at Poverty Alliance, which are led by participants who've taken part over the last year. For taking action in rural poverty, we followed this approach where we hadn't been in Aberdeenshire before, so we built relationships with trusted partners, people who already had relationships with people on low income, to find where we also looked to see where any existing networks and forums existed. We sent out leaflets and emails, and then we held getting to know you one-to-one calls with people interested in taking part. We built an ideal participation structure. So who did we want to hear from? So I'll show you the makeup of the panel just now. So we had 13 people. One person had to leave because their housing situation meant that they were traveling 85 miles a day to access adequate schooling for their child, so they couldn't continue. They had to leave the area. We know that a panel is never going to be 100% representative of a whole area, but it's as close as we possibly can. So we can see that we've got 12 people now, mainly women, mainly white, and mainly either have a disability or are in a caring role. And we think that that's fairly representative of not just Aberdeenshire, but of the face of poverty in Aberdeenshire, rural poverty in Aberdeenshire. We supported people with access to devices, data, IT support, Zoom practice, but through every session we use things like Menti, Miro, Google Forms, sharing docs and voting, and we ask people not just to feedback in breakout rooms, we ask them to do things in twos, or we facilitate groups, or we don't facilitate groups. So we try and vary these sessions so that people build capacity and skills as we go. The group is spread across a large geographic area, meaning we have to work online. We've developed a working together agreement based on respect, and that includes keeping to time, holding participation sometimes to make sure everyone gets a chance to speak, disagreeing well, focusing on experiences and not opinions. And they've also asked for a check-in after each session to make sure that everybody's okay and feels heard. So what have we achieved? So we've increased awareness of projects across Aberdeenshire by inviting them to speak to the panel and shared learning, and enabled the panel to feed into those projects to strengthen them. The projects have included things like community transport, food and security projects, research approaches, community resilience and support, and different approaches to accessing advice and information. We've worked to bring campaigns and decision makers to the panel and vice versa. And we've also got test of change projects coming up. So they've been involved in decision making around that and evaluation. We've encouraged them to take part in other work outside
1 minute,
of.
please, Annie.
Oh, thank you. So they've attended other projects like the Give Us Credit project, attended conferences and events, joining other external panels, and it's also been a catalyst for additional learning for some of those people on the panel as well. We've done reports supporting the Scottish Human Rights Consortium report on human rights breaches in Highlands and Islands. They've done work on the closure of libraries, trying to explain how important those spaces are for people on low incomes in rural areas. And they've been really really key to pushing an agenda around access to healthcare for people on low incomes in rural areas. We're working with the engagement team, but an ultimate success for us would be people thinking, what do the panel think when they're making decisions? That would be the ultimate sign of success for us. And when I think about the name of this event, I don't think about what are the sparks of change. I think who are the sparks of change. And increasingly, they're less likely to be those duty bearers and decision makers and politicians. And it's more likely that they're going to be community workers, volunteers, and the people with lived experience of poverty and injustice. For me, this panel and the people on it are the embodiment of that. And one of the most fundamental outcomes of the panel is solidarity, that people feel with each other and the connections that they've built. They are 12 community activists now who know how to use their voice, have found their focus, and understand that their experiences, though traumatic, difficult, and life-changing, can be used to make change for others, even if it is small or slow. At least it's moving forward together. Thank you very much.
Thank you, Annie.
Thank you. Thanks very much, Annie. That was great. Really good to see a mention of human rights as well. I think we forget how important that is when we come to talk about poverty. So next speaker is Amanda. I think you're with us now, Amanda.
Yep, no, I've been here.
Good. It's good that Annie made mention of health, because I think you're going to talk to us about, you're the Business Development Manager, Active Communities Renfrewshire, and you're going to talk about health inequalities as well. Is that right?
Indeed, I am. Yes.
Thank you.
Good afternoon, everybody. I hope you're all having a good day. It's very sunny here in Renfrewshire today for a change. So my name's Amanda Milson. I'm Development Manager for Active Communities. We're a health and wellbeing charity based in Johnston in Renfrewshire. We've been going for about 20 odd years now, but in the last 3 years, we've moved into a former police station, which we had a community buyout for a £2.2 million project, which has allowed us to expand our health and wellbeing programmes and activities. So I'm going to speak to you a bit today about what we do as an organisation and where we react to health inequalities as an organisation. So our basically Active Communities are a health and wellbeing community-led organisation who hope to reduce health inequalities through our programmes, improve general health and wellbeing, tackle poverty where we can, and reduce loneliness and isolation. So next slide, please. So here's a bit of a kind of a stark look at where we are just now. So this is a relatively I guess typical of some places in Renfrewshire. Probably most of you would recognise Fergusley Park, which was always kind of quite high up in the SIMD rankings. And as you know, the next rankings will be out next year. And what we've seen is probably another area in Renfrewshire is going to be quite prominent within that in the next year. So we're starting to look at a place called Gallaghill, which is in the centre of Paisley, but there's quite a few places in Renfrewshire that do suffer from multiple areas of deprivation. What you can see here is people are 9 times more likely to have alcohol-related admissions to hospital. People are 18 times more likely to have a drug-related death. The rate of premature deaths between the ages of 15 and 44 are almost 5 times higher. The rate of probable deaths by suicide is 3 times the rate of the least deprived areas. Almost 1 in 4 of our children in Renfrewshire live in poverty. The rates of domestic abuse are higher than the national average. And quite frankly, this is the one that always gets me. 75% of babies in our most deprived areas are not exclusively breastfed at 6 to 8 weeks. And some of those statistics that I was talking to you about Gallaghill, that we've recently discovered, the kind of infant, I guess, lack of nutrition, access to good quality food. There's some stats coming through from children under 5, which I'll come on to in a minute, which are quite stark in this day and age. and 1 in 4 people experience mental ill health at some point in their life. So how do we respond to that as an organisation? I'm going to talk you just briefly through some of the programmes that we do here, and then focus on a couple which are directly related to health inequalities. Most of our programmes are funded, and some of them are actually going to be coming to an end in the next year. And we're looking at other methods of funding just now, but the ones that are active at the moment is our Healthy project, which gives people access to essentially a lot of wellbeing programmes and exercise classes such as yoga and Pilates, exercise, mindfulness, etc. These are all free. We have our community pantry, which is another one that I'm going to come back and talk to you about in more detail. Our Round the Table project, which is Scottish Government funded, and that was a 3-year project, is all about access to knowing how to cook in a budget, cook healthily for your family, what's important in terms of nutrition, and we have a community chef embedded within that project. Learn to Grow, Grow to Learn is basically the garden within Station 7 where we're based. Nurture in Nature, again, is a bit of an outdoor programme. Thrive Under 5 is a health and social care partnership pilot initiative, which I'm going to come back and talk to you about in a moment. Our community health champions are basically our kind of cohort of volunteers, which is sitting about I think about 79 at the moment, volunteers who support us, but they also do befriending. Some of them go on to further employment opportunities. Some of them have actually just, been really lonely through lockdown and have now made new friends. So our volunteers are also pivotal to what we deliver within Station 7 and active communities. Hearty Lives is a peer education embedded schools that promotes mental health and wellbeing across Renfrewshire schools, and we have a project manager that delivers that for us within schools. Empowering Parents, Empowering Communities is a kind of 8-week programme to help develop parents' skills and build their own confidence about how to deal with their children and some of the issues that they may face as parents or guardians or carers. Young and Equally Safe is really about kind of being mentors in violence, and that's young people that we actually train through schools to be advocates for that, and that's been a really successful programme. So back to a couple of them directly aligned to, sorry, can I go back to the last slide? Sorry. Thank you. A couple of them directly aligned to, health inequalities. Our community pantry, like most pantries or larders across Scotland, I'm sure, we run a small membership programme, which is £1 to join and £2.50 for every shop, which yields usually about £18 to £25 worth of shopping. Now we're signed up to a Fair Share membership, which is a weekly delivery we get. We are at the moment only able to open our pantry a couple of times a week because of the amount of food outstrips the demand. So a typical Wednesday, which is a pantry day for us, we open at 10 o'clock. We stock up on a Tuesday with the help of our volunteers. We as an organisation have to buy top-up food every week for that, unfortunately, and we can't keep up with the demand. Usually about 8 o'clock in the morning, people start queuing for our pantry, which actually doesn't open to about 10 o'clock. And usually there's about 90 to 100 people coming through. Now, our Robertson Trust, we had a Robertson Trust application which has supported the pantry for the last 3 years. That's about to run out, and I think it's quite stark for pantries across UK, particularly Scotland, about how you feed people who need how you challenge how that's done at a UK government level also, because once we don't have the funding, we're not sure how we're going to be able to keep that up. But we know within Johnston, where we are, that there's demand for food week in, week out. People are having to choose between food and heating, and that's a real struggle for us. So I think one of the things that I would like to see certainly is Scottish Government to be looking at a sustainable model that can help support communities across Scotland and indeed the UK. If we're having to kind of,
That's a 5-minute
I don't see
warning,
food
Amanda.
poverty being eradicated anytime soon, even though UK and Scottish Government wish to see an end to that. I think if you're on the streets every week, or for us every Wednesday, we see that there is still a need there, and that the cost of living crisis is still having a huge impact on families. So whilst at the moment, we're trying to keep up with that, we also feel it's fundamentally important that actually visiting a pantry or a food bank, there should be dignity about it, there should be choice. And we try very hard to do that. We have our chef making homemade soups. We also give away sort of free fruit and veg every week as well. And that's about just trying to kind of trying to also educate as well as kind of provide for families. The other one that I wanted to talk to you about today was a pilot called Thrive Under 5. So the Health and Social Care Partnership asked us to be a pilot for Renfrewshire to work with families who have children under 5. There was certain criteria that you had to meet to be eligible for that. So it was one or more children under 3, depending on your status as a refugee or an asylum seeker, unemployed, long-term unemployed, any sort of disability. So what we've done is we've engaged over the last year with blocks of about 20 families at a time. And what we do is every Monday they come in for free. They basically, we give them equipment at the start of the process. So they're given an air fryer or a slow cooker or any other cooking equipment that they need if they've not got that. Every week we give them a meal pack, which is a lot of fruit, veg, recipe kits, all the staples they get at the start as well. And we also have our chef and community development worker working with them to educate them about how to buy their food on a budget every week, or cook for their families. So it's a supported process. Alongside that, there is also a programme of physical activity, particularly aimed at the children there. And it could be something like baby massage. It could be any sort of physical exercise, because what was coming through was that, a lot of these families under 5, the carer was struggling to actually do any sort of physical activity with the children. In some cases, unfortunately, we saw that the parents didn't actually know how to interact with their children in terms of fun play. So we've looked at all of that as well. And we actually did a case study yesterday, and it was a young Somalian man with a family of 4. And this programme has actually been transformational for him. What I think is important about our approach to tackling inequalities as well is that we don't just do this on our own. In fact, if I could go on to my next one again, let's see, sorry.
That's okay. There's 1 minute left there.
Okay, right. Well, I'll just keep talking then. We very much try and work with partners. Here we are here. So every day, every pantry day, we have in Citizens Advice Bureau, we have Renfrewshire Council's employability team in. We have Social Security in every Wednesday as well. So what we are doing is we're taking those services are embedded with us on a pantry day, so that people have got a kind of one-stop access, and that's been really successful as well. So I think that kind of integrated approach for us has definitely worked. But there's a long way to go. We're a very long way off. I'm afraid people been out of foods and fuel poverty, but we do our best to try and help. Thank you.
Thank you so much, Amanda. I know that you've got to go, Amanda, and we're bang on time. So what I would do is I would ask if anybody has any questions for Amanda, if you could pop them in the chat and we can facilitate them to Amanda via Moray Food Plus in the future. I hope that's okay, Amanda. That was really interesting, but it's being recorded, so all your slides will be shared. So thank you very much for your input today.
Okay, thank you.
Thank you.
Thanks very much for having me. Bye-bye.
Okay. Now we've got Maggie Hepburn. Maggie, you're going to be talking, you're from the Aberdeen Council of Voluntary Organisations, and you're going to be talking about Cash First and funding for men. So over to you, Maggie.
Just checking, is that shared now?
Yep, that's good.
Good. Let me just put up the big screen for myself. Thank you very much. It's been very interesting hearing all of these speakers today. It's a subject close to so many people's hearts. My name is Maggie Hepburn. I'm Chief Exec, as Lindsay said, at ACFO, which is Aberdeen's Third Sector Interface. And obviously your Third Sector Interface that you'll be familiar with is TSI Moray, who are our counterparts in Moray, and we work with them. We know them quite well. So always wonderful to push a little advert for the TSIs. I'm here speaking about the Cash First project that we are delivering in Aberdeen because our coordinator is currently on holiday this week, and her name is Amy Duncan, and her contact details will be in the end of the presentation. So if there's any questions that are too difficult for me to answer, I will have to send them to Amy for an answer instead. So just to tell you a little bit about it. So this is our Cash First project. The Cash First approach forms part of the Scottish Government's response to financial hardship and their aim to reduce the need for emergency food provision. They recognise that the main reason why some people are compromising on food is insufficient and secure incomes, as we've heard earlier. The Scottish Government pilot Cash First towards ending the need for food banks in Scotland sets out a human rights approach to tackling food insecurity. It offers a test of change to understand how financial support can replace emergency food provision across Scotland, with the aim of creating more dignified solutions to crisis support through improving urgent access to cash in a crisis, and by providing money advice and holistic support services to prevent future hardship. There are 8 different areas participating in the pilot, each doing something very different within their areas. So what is Cash First? Cash First provides people directly with money and/or pathways to money when they're facing crisis. Alongside increasing incomes, adequate advice and support, it's fundamental to our Cash First approach. Cash First will look at streamlining and supporting the existing referral pathways to ensure those in poverty are improving their access to wraparound support. This will include advice regarding benefits, housing, employment, and health. Cash First can be an effective and dignified form of support for people facing financial crisis. It offers flexibility and choice for people to decide what their immediate needs are and choice on what they wish to spend the money on, what might be about purchasing essentials or paying a bill. The Aberdeen Cash First network was designed alongside our partners in Instant Neighbour, Seafine, which is a large, substantially large food bank covering a large amount of Aberdeen, Alcohol and Drugs Action, and Aberdeen North Food Bank, and with the input and knowledge and understanding of the demographic by various local and national organisations. A high proportion of those accessing emergency food banks within Aberdeen City and nationally are single males from the ages 18 to 45, with a number of those from the demographic being repeat users when in receipt of universal credit. The Aberdeen Cash First project will focus on this demographic by offering the Flexible Crisis Fund to those facing financial emergency, providing them with money and improving access to wraparound support. ACRO have designed the Cash First project alongside our partners with the aim of breaking the cycle of repeated financial crises. There are hopes that the project will also reduce reliance on food banks within Aberdeen City, positioning them as a last resort for emergency help. A high proportion of those accessing emergency food banks within Aberdeen City are single males from the ages of 25 to 45, with a number of those from the demographic facing repeat crises when in receipt of universal credit. The fund offers options via vouchers, cash payments or direct payments, for example, to utility suppliers. The project also focuses on improving access to financial advice and holistic support opportunities. And this is done by streamlining coordination and sharing information between services to strengthen cross-referral partnerships. The next couple of slides were built from Amy's work with interviewing the demographic over a period of a few months. And it was to try and understand, when we were building the framework for this project, what some of the barriers were that the people who were actually experiencing food bank use were feeling from this cohort of men. We have included people with lived experience. We've surveyed 70 individuals. Single men 18 to 45 in receipt of universal credit are a particularly challenging experience when accessing crisis support. We were able to identify over 40 barriers to accessing support. The ones in red are those which come up most often in conversation with lived experience individuals. Societal stigma for males in crisis and seeking support has a considerable influence on their mental health and decision making. From those surveyed, the demographic often feel embarrassed, shamed and judged for seeking support due to the stigma surrounding their gender and strong feelings that they should be able to manage without needing any support. That's the next one as well. And there may be, those of you who are working across this field will recognise these barriers instantly. We were just shocked at the enormity of the level of barriers that there are for this particular demographic and for everybody, let's be honest, but it was this demographic we were working with. Through the delivery of the Cash First Fund and looking at how to collaborate and improve communication, we hope to reduce some of these barriers, especially when in crisis, and increase the number in the demographic knowing where to seek crisis support. Individuals can be referred to the fund through the trusted partner organisations who are currently involved with the Cash First network. Currently, this is Aberdeen North Food Bank, Seafine, Instant Neighbour, Alcohol and Drugs Action, Aberdeen Serenian, Social Bite and Aberdeen Foyer. The trusted partners can refer the individual for up to £600, either for a one-off payment or for recurring payments, depending on the individual level of need. Recurring payments can take place on a monthly basis of a maximum of 6 months. Recurring payments depend on engagement from the individual with wraparound services identified by a panel. Where an individual does not engage, they will not receive the next payment instalment. This is to incentivise engagement with wraparound support services. The Crisis Fund will be delivered or is being delivered to individuals via vouchers, cash payments or direct payments, depending on their ability to budget the funding and any risks around providing them with cash payments. This particular demographic, we had to have a risk management scoring system because from our lived experience chat with the group of men themselves and also from the services that they access at the moment or have worked with, it was clear that some might be of higher risk and then prone to potentially purchasing addictive substances or dangerous substances that could potentially cause them harm. So the risk matrix is used by the panel to ensure that everyone can benefit from the funding. The risk will determine what method of funding is distributed to the person, and that's directly from the men themselves. So there were some men that Amy spoke to who said, don't give me cash. I'll just spend it on things that are not good for me. And that has been very interesting in itself as part of the learning for this project. 4 key needs for the fund, crisis fund, were recognised based on the answers provided by the lived experience voices. So the four are on the screen here. So they were the cost of living, so income to cover the enormous cost of living increases. debts, paying off debts, small debts that people have incurred that have then turned into larger debts if they try to pay them off. Employment, supporting return to employment, a way into actually coming back into earning fund and earning money again, and supporting periods during where there's a transition between benefits or where there's a transition period before but money from benefits is received, and people may have to wait about 6 weeks, which then contributes to their level of debt. Due to this, the flexible crisis fund can be used for a variety of needs as long as the overall aim for providing the funding is to reduce the reliance on food banks and maximise income in the long term.
That's 5 minutes, Maggie.
Okay, I'm not far off, don't worry. This is the referral process. So a little bit about the referral process. So at the moment, you can see that this is how we work. So the person, usually a long-term user of the food bank in most instances that we've had so far, is referred to a panel discussion made up of the trusted partners. The trusted partners make a decision based on the risk matrix and agree what amount of funding, what kind of instalment procedure, and the funding is then released from ACFO to the trusted partners in its entirety to be paid out on that basis. There's a monthly report completed by the referrer. The person is the person receiving the funding has given consent for their information to be shared at the panel, and the panel meetings have actually borne enormous fruit in terms of the knowledge and experience of other trusted partners being able to contribute ideas and wraparound care to the individuals who have been accessing this cash fund. So these are the ones that, this is for people that know Aberdeen. These are the trusted partners. And as you can see, they come from a wide variety of support networks. So between them all, the wraparound support that they can give together to one individual is huge. So, and that has been what has been happening. So a person may be referred, there will be contributions from all trusted partners saying, I can help with this. Have they thought about doing this? Why don't they come over to us and get some of this? You know, so that sort of conversation, even at panel level, is so helpful for going back to the person and actually saying these are the kind of supports that are available to you. So once the referral is approved, the trusted partner supports the individual to manage the money and with encouragement from everybody, the other services. This is where they need support from everyone to encourage them to stay in the process and take part in the whole process rather than come back from it. So it has been successful so far. There's been 83 referrals since the project started in October last year, and of a 76% reduction in the use of food banks from those individuals who are in receipt of the Cash First fund. So the final slide, so I'm ahead of time a little bit, is really just please have a look at the web page that we have about the fund, which is on our website there, acfo.org.uk/cash first. And there's Amy's details as well. Amy will be glad to speak to anyone who's got any questions in particular about any of the detail that people might be interested in. It's a 2-year project, the Cash First project, sorry, and we've got another year to go on it. And we really are finding it quite interesting, and all the trusted partners are finding it quite interesting in terms of what we're learning about where people's particular difficulties are and why they do end up as presenting at food banks for this particular demographic, which is a very challenging demographic. So thank you very much for your time. Appreciate it, and save all difficult questions for Amy, but please put them in the chat.
Thank you very much, Maggie. That was absolutely fascinating and amazing to see a 76% drop in the food bank use by that cohort. So thank you so much for that. And we'll look forward to some questions, hopefully, for you towards the end of the session. Next, hopefully, David Kidd is with us. David, are you with us?
Hello.
Hi, David. David, you're going to talk to us about you're with the Scottish Association of Care and Resettlement of Offenders, and you're going to tell us about lived experience and shaping policy and practice. So over to you.
Hang on a wee sec. Let me share my screen. Okay, can everybody see that okay? Somebody wave their hand.
Yes, David, we can see that.
Brilliant, brilliant, thank you. My name is David Kidd. I work for an organisation called SACRO. These days it's just SACRO rather than the Scottish Association for the Care and Resettlement of Offenders. And I'm quite glad of that because, to be honest, that's a bit of a mouthful. I have been working in and around about participation in co-production, both as a practitioner and also as a trainer and consultant for about 15-ish years. Previously in the world of homelessness and more recently within the justice sector with SACRO. And I'm going to spend, I was going to say about the next 15 minutes, but I'm going to spend exactly 15 minutes or less, I've been told, talking in general and more specifically about ensuring people with lived experience are meaningfully involved in decision making. So going to kick things off by talking a wee bit about why lived experience matters. And then I'll also talk a bit about the barriers that people face and how co-design and co-production can help improve things. As well as that, I'll also share some practical approaches, including some of the examples from the work that we do at SACRO. And I'll cover off some of the common fears about involving people in shaping policy and practice. Plus, I will also definitely be around at the end if anyone has any questions about anything that we cover. So, why does lived experience matter? So, the people that are most affected by policies and services are usually the ones that have got the least say in shaping them, even although they are the people who are generally best placed to tell us whether or not they actually work. When we involve people properly in them, we get things like better decisions, stronger policies, and ultimately better outcomes. So co-production is first and foremost about sharing power. It's about working with people that have lived experience and not just consulting them after decisions have been made or halfway through a process. Done well, it improves things like trust, it strengthens relationships, and it makes policies and services more effective. So, if we're saying it has all of those benefits, then why are we not doing it all the time? There's a range of things that are real life barriers that are meaningful, that are real problems for organisations and people. Some of them are practical barriers, some of them are systemic things, some of them are cultural, but regardless of which of those categories they fall into, they're all real. Some of the kind of structural things that get in the way, so there's things like a lack of trust, and that goes both directions as well. So there's a lack of trust often from people we support in terms of them being involved in things historically and feeling as though nothing changed as a result of it. There's also a lack of trust the other way sometimes as well, where people with power don't necessarily trust that the people that they involve who have experience of using their services will have the best interest of the services at heart. I mean, I'll come on to why that's not true in a minute, but it does happen. There's also things like the rigidity of systems, a history of people being ignored or marginalised. As far as practical barriers go, there's absolutely tons of them. There's things like challenges around about literacy issues, digital exclusion, format accessibility problems. All of those types of things can make it impossible for people to engage before it even begins. There's also organisational barriers, so things like organisations worrying about risks. So what if people criticise the organisation? What if they challenge us on things that we hold dear to us? What if they don't feel safe sharing experiences? I have to say, if that is the case, then the work that we're doing is already failing them if they're not feeling safe to share their experiences. So if participation isn't meaningful, if it doesn't genuinely account for the needs of the people that we want to involve, then people are likely to disengage and we might lose the opportunity to actually make real change. So what does good look like? Good engagement isn't about inviting people to a meeting. It is about designing engagement that's meaningful, respectful, and leads to real change. There's a range of good practice stuff. I'm not going to go through that whole list, but there's some things that I think are worth highlighting from there. things like language, I'll come on to framing again in a wee second, but things like language, just in terms of accessibility, jargon, deficit-based language, all of that stuff is hopefully to be avoided. There's issues around about accessibility that I mentioned previously. So participation is a bit like, engagement is a bit like learning styles. There's a whole raft of different ways that people like to engage. So if we can provide options for people, then it's much more likely that they'll find one that suits them and that they'll get the most out of their involvement in the process. Whether that is verbal, written, digital, face-to-face, any of those, combination of those things. Yeah, there's options in there for everyone. We need to be transparent, so that includes things like managing expectations, not over-promising, so making sure right from the very beginning that people are aware of what they can influence in terms of the change process that they're going to be involved in. Obviously, we need to be trauma-informed, and also it's really important that we just feed back to people about the difference that their input has made. So I mentioned previously I was going to talk more about framing. I think from that whole list of stuff, that's probably the most important thing, or the thing that I find most regularly that is a trap that people fall into. And it's about kind of expecting people to engage on our terms. When we ask people direct questions about policies or service improvement or anything along those lines, so things like how can we make our service more accessible, or how can we improve our trauma-informed approach? The reality is that most people don't really care about policy frameworks beyond how they impact them directly. And why should they, I suppose? Like they're not paid to think about that kind of stuff. It's us that are. What they are experts in, though, is their own experiences. So it's if we frame those slightly differently, it's much more likely that we'll get real genuine engagement from people, and they'll have a good experience of getting involved. So they are the world's foremost experts in their own experiences. So instead of asking how to improve a policy, ask them about what worked, what didn't, what could have made a difference for them. And then it's our job to draw insights and conclusions from that, and then translate that information into changes that need to happen. So with all of that good practice, what can we do to create the right opportunities for people? There's a range of different approaches that we can take. As I said previously, different approaches will suit different people at different times. Not everybody wants to be involved in the same way. So there are a range of individual ways that you can involve people. So any service that provides support to people probably already do at least one of these. If you do person-centered support planning, then that is a form of participation, as long as you take the information that you get from that and then use it for something else that's not just about supporting the individual. So if you take that and use it for service improvement, then that is a participation or co-production approach. What you can do with that is make sure that the service that they receive is tailored to their needs. But if you put in place the systems that sit behind that to take the information, draw the insights from it, and then scale it up to the service level, you can influence practice across not just that service, but any other services that you run at the same time. We also do things like exit interviews and draw conclusions from those that can be used across services. Look at identifying trends, highlighting areas for improvement, and using all of that stuff to shape future service delivery. We also run a range of lived experience groups at SACRO. So we have a domestic abuse service, for instance, where they've got a weekly lived experience support group. So it's like a kind of dual purpose group. So they have a peer support function, as well as functioning as a kind of action group, like a participatory action group that seeks to make improvements to the policy and practice landscape around about domestic abuse, domestic violence. That group has worked with the Inspector of Prosecution in Scotland to influence the way that they work, as well as a range of kind of Scottish Government activity. So before it slightly fell apart, they were quite heavily involved in work around about designing the National Care Service. They were also involved in some of the offshoots of that work that help shape things like the ethical commissioning framework that Scottish Government are going to be using, amongst a range of other things about service assessments and guidance around about access criteria and things like that, amongst some of the other participation groups that we also run. We also have like ongoing regular engagement with Scottish Government and local authorities to make sure that the perspectives of people of all components of the justice sector have opportunities to input into the design of policy at that kind of local and national level. Peer approaches are another thing we do a lot of at SACRO. That could take the form of peer engagement. So that kind of breaks down barriers to engagement. It often speeds up that process. I mean, like
5 minutes left, David.
No worries. So talking to somebody that's had similar experience often just kind of speeds up the process of people engaging. It helps them to engage more openly, more meaningfully. We're also just beginning the journey in SACRO to make sure that the governance of our organisation includes people with lived experience as equal partners, equal trustees of the organisation. That has taken some time to get there, and we're not there yet, but there's a range of stuff you can do around about that side of things too. This is the model that we use within SACRO. So we've got a range of service level work where we engage people in a whole raft of different ways, similar to the ones that I've just spoken about, but loads more. Lots of participation groups, lots of kind of surveys and work to engage the people that use our services directly to be involved in making sure that our services continuously evolve and are always fit for purpose. Following up a level from that, we've got various groups that co-produce the way that we work as an organisation. So there are a range of insights that we gather from that service level work that the levers to resolve don't exist at service level, they exist at organisation level. So all of the information from that feeds up into the next layer up and then gets used to make improvements across the whole organisation. So for instance, we've got multiple domestic abuse services. So that group that meet regularly, they have the work that they've done feeds into all of the other services to make sure that all of them can benefit from the insights and experiences of the people that one service support. Then we've got an outward facing bit. So there's also a range of stuff that comes out through the work of those groups at service and organisational level that the levers to fix don't exist within SACRO at all. They exist either within Scottish Government or within local authorities or within other statutory partners. So that level is about supporting system change activity and working with those statutory partners to make sure that the views of people that we support across the whole breadth of SACRO's services are included in that decision-making process. And then the final level is the governance level that I talked about previously. So we're nearly there with that one. We're at a point now where we are finalising policy and process just to get that in place and to make sure that all levels of SACRO will have the input and experience or benefit from the input and experiences of the people that we've supported. So I mentioned at the very beginning I was going to talk about some of the hesitations or fears that I have heard about over the years. So a lot of organisations that I've worked with over the years have a fear of criticism, so fear of losing control. But if, like I mentioned previously, if people don't feel safe sharing the information about their experiences, then it means we're doing something wrong upstream. So co-design should lead to better, not riskier outcomes. I often hear about some of the unpredictability. So what if somebody says that, so when I worked in homelessness, the example that was often given was, what if somebody says, I want a house with a front and back door that has a swimming pool and a helicopter pad and like all of these other things that just aren't available in general housing stock. And I mean, that's
1 minute left, David.
No worries. First and foremost, that definitely doesn't happen. In general, the people that we support across our organisation just want the same things we do. They want better outcomes. They want to receive the support that they deserve. And if I'm honest, that is what underlies all of these fears. There is exclusively better outcomes that happen when we make the effort to involve people in the ways that they need. We need to stop expecting people to fit into our systems and start designing engagement that fits them. Thanks, folks. As I said previously, I'll be around at the end to answer any questions.
That was great, David. I loved the triangle. I took a photograph of it. I thought it was really good. So our final speaker is Caroline. Hopefully you're around there, Caroline. You're the Anti-Poverty Development Officer from West Lothian, and you're going to talk to us about financial advice in the education setting. Over to you, Caroline.
Hi, good afternoon. Thank you. Yes, that's kind of what I'm going to cover with you today. I'm just going to try sharing my screen. Apologies, I don't often use Zoom, so I'm not overly familiar with it. But I will share my screen with you just now, and hopefully that will work okay. If somebody can give me a little shout and let me know that you can see it okay, that would be great.
Looks like it's, yep, there we go. Yeah, we've got you.
Oh, that's great. So yeah, my name's Caroline Doyle. I'm the Tackling Poverty Strategy Development Officer with West Lothian Council. I'm based within the Anti-Poverty Service within the council here. And I was kind of asked to come along today and give a bit of an overview on a project that we have been running for the last few years on how we have approached some kind of initiatives to tackle child poverty in West Lothian. In West Lothian, we are in a fortunate position that we've got a great kind of a great approach to partnership working, and we have a tackling poverty task force and partnership who are very often looking for new ways to work together to bring services and advice to people that need that. But back at the time that we first introduced our kind of advice and education settings, child poverty was something that was really embedded into our tackling poverty strategy. It still is, but we have a subgroup now that kind of looks after our local child poverty action report, known as our child poverty reference group. But back at the time that the pilot was introduced, most of our child poverty actions sat within our anti-poverty strategy. Poverty in West Lothian, child poverty in West Lothian in particular, we have around 1 in 4 children in West Lothian who experience poverty, so probably a kind of similar level to the Moray area. But for us, we're kind of concerned with the kind of key priority groups around child poverty. And what we found is that poverty is on the rise. And so despite our kind of efforts to mitigate that to any extent, like a lot of areas, we've seen kind of increases in levels of child poverty. And we're quite clear that the key priority groups of lone parents, households with a disability, larger households, and young families are getting the support that they need, because we do recognise that those are the families that are at higher risk of experiencing poverty. So in West Lothian, we have a Better Off West Lothian Tackling Poverty strategy. It's a community planning partnership strategy, so it doesn't belong to myself or to the council as such. It is a wider strategy shared by a number of organisations within West Lothian, a number of anchor organisations that sit on the community planning partnership board. And that strategy really has 4 main priorities attached to it, which you can see on the screen there: addressing increasing cost of living, increasing income from employment, maximising income through social security, and working together to reduce stigma and promote the support that's available. And our tackling poverty strategy was refreshed in 2024. And it's a 5-year action plan based on these 4 strategic outcomes. that we all work towards. The refresh strategy is underpinned by a suite of performance indicators, and we also have an annual action plan attached to that strategy. And each of our kind of work streams within the council and the other anchor organisations feed into that strategy to ensure that we're kind of embedding that approach across West Lothian. But I'm here today to talk more specifically about a pilot project known as the Families and Young People's Advice Service. The Families and Young People's Advice Service sits within the Advice Shop here in West Lothian, part of our anti-poverty service, and it is made up of a number of services or a number of kind of projects. We deliver funding to remove financial barriers and support people into paid employment opportunities, what we call our PESF, which is Parental Employment Support Fund, which is financial grants awarded to families in 3 stages who are looking to make a return to work or sustain a return to work. We had, at the time of starting the pilot, a dedicated income maximisation service for care experienced young people, so people who were coming through our Through Care Aftercare service, and people who were working with care experience leads within education settings in West Lothian. And we have a number of projects to deliver poverty awareness training to partner organisations and deliver a range of events and activities around National Awareness Days, such as Challenge Poverty Week, to make sure that families across West Lothian are aware of what support's available. But one of the key things that we have done throughout this pilot project is to introduce co-location of advice within schools and partner agencies. And this started out in 6 pilot schools across West Lothian. We had Whitburn Academy, Bathgate Academy, St Kent's Academy, and St Margaret's Academy, Inverraman Community High School and Dean's Community High School. So geographically spread across West Lothian. But it started off predominantly in high schools in West Lothian, and the approach was modelled on a similar approach delivered in Glasgow, and the schools were chosen based on our SIMD deciles and kind of data to make sure that it was targeted to schools that we felt needed that support quite highly. The team and the pilot project also included an officer working in early years centres to offer financial advice to families, but that was very much on the basis of kind of looking at that return to work, and it was attached quite heavily to our PESF fund around that kind of financial support available to households that were looking to make a return to work. And that parental employment support team work quite closely with our Access to Employment service to support parents who are looking to navigate that return to work, and we do quite a lot of kind of joint work with the employability team to raise awareness of what support is available for families looking to return to work, and to kind of remove barriers, particularly financial barriers that people face when they are kind of returning to work. At the moment, we have 2 campaign development officers in our what we call our schools team, and we have a 0.5 FTE campaign development officer working in our PESF team to promote that through early years centres and to administer that grant funding to families across West Lothian. And our campaign development officers really work to develop relationships within the targeted schools. We initially set up the project with co-location within our 6 target high schools on a twice weekly basis, and that co-location consisted of the advisors having their own space within schools, the ability to connect to all of our network and access everything that they would be able to access had they been working from our advice shop office in Bathgate. What they also did was embedded themselves within the school kind of faculty, and really became what we would kind of class the Kent face here in West Lothian, and really started to work with the schools to make that service just part of normal school life for the families. And we think that's really what's been kind of pivotal in supporting families through that education setting, is kind of taking it through that co-location approach and becoming part of that kind of school environment. And once in schools and once embedded within the schools, the campaign development officers offer a holistic approach to the advice that they're giving to families. First and foremost, they'll look to maximise their income, but we also help them deal with problem debt. We provide budgeting support. And what we also started to offer in partnership with the school staff was some courses to more senior pupils on kind of future-proofing their finances. So some budgeting courses, some poverty awareness and myth-busting courses delivered to senior pupils within the schools as a bit of a preventative action to ensure that they kind of were leaving their high school career with that kind of knowledge and with that skill by their side.
There's 5 minutes, Caroline.
Thank you. So the Families and Young People's Advice Service, after our kind of initial pilot with the 6 high schools, we decided to expand that out. What we recognised was there were certain aspects of that pilot that were working really quite well, and we wanted to kind of build on those and expand them out to ensure that we were supporting as many families across West Lothian as possible. One of the things that we did was we decided to continue with our co-location within schools, but scale that back a bit. Along with the expansion, didn't come any kind of increased funding levels, unfortunately, for the project. So we decided to pull the high schools back to once a week co-location and introduce some primary schools into our kind of co-location model. And the way that we did that was we took a data-led approach. In West Lothian, we've had quite a bit of work on a child poverty index, which allows us to identify at quite a granular level, a local level, using local data from our free school meals, school clothing grant, kind of overlaid over the SIMD data to allow us to identify geographic areas that have kind of low uptake, high need amongst families. And we used that data to identify a number of primary schools across West Lothian that we wanted to develop stronger working relationships with. We also decided at that point to work closer with ASN schools and support hubs across West Lothian so that we could offer that kind of named advisor approach to families with kind of some form of disability in the household. And we also decided that we were going to look at how we could support young people in their pathway to work. And we have a volunteering coordinator who worked on a placement offer for young people for volunteering opportunities. And some of the outcomes that we've had so far from our expansion, you can see on the screen there. We've continued to deliver funding to families to remove financial barriers to employment. We have established 2 co-location pilots within ASN schools across West Lothian, and have started attending ASN events. And we have started to engage with young people through our volunteering course that has been established for them. So we're finding that expansion is working quite well. But what we have found is that it's not something that we've managed to achieve by ourselves. We've had quite a bit of support and quite a lot of partnership work involved in this pilot. It goes without saying that education support and business management services have been heavily involved, as well as the school staff themselves. We've worked quite closely with employability services to gain quite a lot of outcomes for the families that we've been working with. And in West Lothian, we've been working with our Scottish Attainment Challenge leads and working groups, as well as the family link worker networks across our education colleagues to make sure that the pilot kind of has the biggest impact that it possibly can. In terms of the Child Poverty Index, we're currently in the process of expanding the data out that we use for that. Like I mentioned, it currently uses SIMD data and is overlaid with data that we hold. And we've recently been given funding from the Child Poverty Accelerator Fund to expand that out. And some of the things that we're looking at doing is bringing in data around debt and also some data from our food partners and Scottish Welfare Fund. Great, thank you. In terms of next steps for us, like I mentioned, we've got a successful funding application for the Child Poverty Accelerator Fund to expand and scale up the Child Poverty Index, which will inform for us where we take our co-location next in terms of geographical areas and which schools we will target. We are looking at developing an interactive dashboard with the improvement service to share what the Child Poverty Index tells us and also share some information for parents on support available in West Lothian. And with more data, we hope to develop our approach further into other areas such as debt and food insecurity to bring on our colleagues to kind of offer that advice within schools as well. In terms of our key achievements to date, these are kind of some of the kind of things that we've achieved since the start of our pilot. We've had about £1.3 million generated for families with school-aged children this year up until the end of Q3 so far. We've supported around 570 families from a total of 60 schools across West Lothian. We have administered around £36,000 of grant support to 38 parents to ensure that they can facilitate a return to work. And we've successfully managed to expand that schools project to all secondary schools and those target primary schools across West Lothian, working within the kind of resources and funding that we had originally.
That's time, Caroline.
Yep. And there's a couple of slides in there just about priority groups, which are going to help us focus going forward. But happy to take any questions if anybody has any as part of the question panel.
Thank you very much, Caroline. So we've got a Q&A session now. Thanks to all our speakers. That was actually great. I've written loads of notes here. So if you've got a question for any of our panel, if I can ask you to just raise your hand so that Amanda can see you, and if you say who you are, where you're from, who your question is for.
That's lovely. I'll just start off. I'll give you a moment just to gather your thoughts there, but I'll just go through a couple of questions that were in the chat box. If anybody doesn't feel confident on camera, please do feel free to use the chat function and I'll come back and check that just shortly. But a question that had been asked a couple of times was whether people can have access to the speaker's slides. I think that the recording is going to be made available to everybody, so you should be able to watch the slides. But if anybody specifically wanted a copy of actual slides, I think if you get in touch with Moray Food Plus at the end, they'll be able to ask that for you. The other question that was in the chat was directed for you, Ian, and it was a question by Vicky Flood. And when you were going through your statistics, she wanted to know, is this in work poverty?
Didn't make a difference, to be quite honest. It's just a poverty or a financial instability index. So it takes account of all income, but it's predominantly, I mean, majority of, or a high percentage of people are claiming some form of benefit that's probably included. So it predominantly is people who are actually approaching services for benefits or claiming benefits from DWP.
That's lovely.
Does that answer the question?
I think Vicky's indicated, okay, that's great. There was another question here from Sean. Two questions, one for Ian Snedden. Can we access the information about vulnerability in Moray? Is it on the Moray Council website?
I'm not sure it's on their website, but I have a report that was written based on findings. The slideshow you saw was a very whistle-stop tour. The report goes into a bit more detail. I'm happy to share that if Moray might even have a copy of it. But if anybody wants to contact me directly, then please do so, and I'm quite happy to share the report.
I think Sian has said yes, please. Second
Okay.
question from Sian was directed for Caroline Doyle. What qualifications have you delivered in school? It would be really interesting to know. Thank you.
So we haven't delivered any SQA accredited qualifications ourselves as an advice service, but we do have other parts of our community planning partnership and tackling poverty partnership who have delivered SQA qualifications to pupils referred from schools. What we deliver within the schools is poverty awareness training and poverty awareness workshops within schools that kind of approach us as looking for that. That poverty awareness workshop really covers quite a bit of myth busting for senior pupils, trying to kind of change that narrative about what kind of poverty means for young people, what types of households are at risk of experiencing poverty, and what the pathways out of poverty look like for young people. So it's not kind of any SQA accredited qualifications, but we do deliver poverty awareness workshops.
That's lovely. Thank you, Caroline. There's a question from Vicky Flood. I'm not sure whether it's directed to any one particular person, but she has asked, are there any known links between poverty and neurodivergence? And if so, are there any moves to looking into this for anyone? I'm not sure if any of our speakers feel they could answer that one.
Yes, it was a question directed at anybody as on the panel.
Vicky, I haven't seen anything specifically around neurodivergence, but it's certainly an area that could potentially look, need some research. But it'd be worthwhile contacting local universities, or if you've got a university local to you, just to see if they know of anything through their access to data portals that they have. I can't think of anything off the top of my head that I've seen in the UK at the moment, but it's certainly an area that needs it.
Thank you.
I'm just going to check. There was a question here for Maggie, and I'm not sure if Maggie's still here. So question, interested to hear what the feedback was from individuals who received money via your project, Maggie.
The feedback has been almost overwhelmingly positive, as you might expect. Anything that's come that's been sort of questionable, it's been more about the speed of getting funding to them. So in terms of, because a lot of the men who are presenting have got multiple issues with money, then there's some that just haven't been able to be supported because they've got far too many issues with massive debt problems, and so there's only been sort of small amounts of money that are able to be passed over to them. So what we found was it was really slow to start, and we were actually thinking, well, we might not spend this money, and now it's just ridiculous to think about it now. And of course, as soon as word of mouth gets around this particular cohort, because they meet each other and they know each other, then the word of mouth has passed on. But we're sticking to our guns in terms of the system that we've got in place for risk management. But generally, the feedback has been extremely positive from the people themselves.
That's lovely. Thank you, Maggie. There is no other questions that I can help. Hang on a second. Did the recurring payments help with longer term engagement, Maggie?
Yes, the recurring payments cannot be made unless there is longer term engagement. Now, it sounds really hard, but it does sound like, well, you're just putting another hurdle in place of people who've already got hurdles. And we had a long debate about this in the partners, because it was part of the risk management of the cohort. There has to be something in place that indicates that you are in a position to be able to handle or be supported to handle a budget. And part of that is about engaging with services, which are all none of which are hard services to engage with. They're just not necessarily services that people had previously engaged with. Having said that, a lot of people presenting at food banks are engaging with services. You know, that it's just that it hasn't been tied to this before. So if they're already engaging with services, that's good. If they hadn't been, then there have been services put around them that will be helpful, like income maximisation services, or, you know, people giving help with furniture, prisoners released, you know, that sort of thing. So there have been services put in place that they have, that's part of the arrangement for receiving the extended payments.
That's lovely. Thank you, Maggie. I don't see any more questions in there. I was just going to put a little note there as well. I will be putting some other information into the chat that Lindsay's provided me with, and I'm sure she'll explain about that to you when she's closing everything up. But if anybody does want to take a copy of the chat, if your chat is open, there are 3 little dots that says more, and there is an ability for you there to save the chat. I will be saving it and sending that out to you directly, but if it was something that you wanted just now, before that comes out to you, you are able to access the save facility there.
Maggie, I've got a question, a chair's prerogative here. I'm going to ask you a question. Is there any academia looking at your project, or, you know, how's it being evaluated?
The Scottish Government have got this is a Scottish Government pilot. So they've got an evaluation, people called EcosGen. I don't know if anybody else has heard of EcosGen. And also Animate are doing some evaluation. So that's the software evaluation, Animate. I have to say that what's being fed back is quite statistical and number based, as opposed to narrative based at the moment, and that's something that we've been talking about quite a lot as back to the Scottish Government, but also within the partner groups ourselves, just because it's such a complicated area, as everybody has described. It's difficult to put it into number format and tell the story like that, but that's the challenge for the evaluation, I think, for the pilot.
So important to have the testimony of those who are getting a service as well. My other question is for David and Annie. What one piece of advice would you give? I'll start with you, David. What one piece of advice would you give to somebody who is starting up? This is the same question for you, Annie. Starting up a lived experience group.
Good question. So, in terms of a few of the things that I mentioned, I think to take your advice, your one piece of advice from the people that you're hoping to engage. So any engagement group that people are looking to set up, my advice would always be to work with the people to understand what their needs are and what their engagement styles are, so that whatever it is, it's co-produced from the beginning. So when I used to deliver training on this, the mantra was always start where you are. So like involve everybody that you can from as early as you can in the process, but don't wait for the perfect opportunity, because that isn't a thing. It will never happen that way. So start where you are, but involve people as early as you can do, and that includes in the beginnings of the process, so starting something up.
Great. Annie? Is Annie still with us, or she moved? I think Annie must have gone. That's really helpful, David. Thank you.
No, Annie's still there. I think she's mute.
I'm definitely here. Can you hear me now?
Yes, I can. Yeah. What was your one piece of advice? What would your one piece of advice be?
Yeah, I was tempted just to say what David said, but I think it's about thinking about the why. Why are you doing it? I think that's really key. Like, you know, it can't just be to you know, tick a box on a form, or to do it to find out what people think about one thing that you're doing. It needs to be. And the other thing I was thinking about when you were asking is kind of take your time to think about it. Don't just rush into it and think, well, I need to do this thing next week and then that'll be it done. So yes, think about the why and the how, and also what David said.
Great, thank you so much.
There's a question coming to the chat from Jane Harkis. So, hi, Jane here from Children First Moray. This has all been really interesting. Thank you to everyone. Question for Maggie. What form do the risk assessments take? How is the information gathered to measure the risk?
So quite simply, the information about the risk matrix being made was gathered from the lived experience people themselves, from the interviews that Amy did, where she interviewed over 70 people in the design phase, and then from the people who work with people in the food banks or with Alcohol and Drugs Action, or from the trusted partners, putting in their thoughts from a professional point of view in terms of how a person with particular issues might manage or not manage different areas of risk, and how confident we would be about not causing further harm. So that was, we made the risk matrix through discussion prior to anything being handed out in order to have all those bits in place. And then the decision is taken at a panel meeting where people are present, so that the decision about risk is taken then. So the person is assessed by the referrer that refers them and given a sort of traffic light, and then that is further discussed at the panel to clarify any further questions people might have about whether that is the right level of risk or whether there's more feedback that we need before releasing any funds. But generally it's worked quite well. There hasn't been any dangerous situations that have occurred, which was one of our main concerns. So that's great. So far, so good. Hopefully that continues.
I think we have Sophie Smith. Did you want to ask a question, Sophie? Maybe she was just giving us a lovely thumbs up reaction to your response.
Okay, I think what I'll do is I'll try and sum up what we've heard today, so that we can let school out early. Wow, thank you so much to everybody who has spoken. It's been eye-opening, to say the least, but really useful to see the practice that's happening around Scotland. Ian has shared the importance of data and the localised and national, which was great too, and he shared his vulnerability index with us as well. It made me think, Ian, about, and Annie's presentation, you both made me think about coastal communities and poverty, how it affects coastal communities. And I think we need to be a little bit more aware of coastal communities and poverty around coastal communities as well. Annie also mentioned human rights. It was nice to hear human rights mentioned as well, because that's very pertinent to Scotland at the moment as well. And I loved your panel principles, Annie, just great. And both you and David mentioned the importance of feedback to those who you are involved with in your groups as well. Sharing experience, not an opinion. I have written down here, Annie. That's so important, isn't it? So that was good. And the use of IT and digital access was something that everybody seems to have mentioned as well, how important that is, that people have access to information in whatever format that comes, so that they can take part in things as well. Substance misuse, mental health, domestic abuse, breastfeeding as well, all the sort of projects that Amanda was talking about as well, the delivery of a range of projects that are needed within communities. It's quite staggering how poverty is affecting all these different aspects. Risk, the debt was a word that I've heard mentioned quite frequently between all your presentations as well. And Maggie, you used the word trusted partners, and I think a lot of this is about the people that you work with and the organisations that you work with, who you trust to be able to deliver what you expect and what they expect from you as well. And Aberlour, I think, is doing a lot of work around public debt, so it's interesting to follow what they've been doing too. Cost of living, I think it's just more the cost of keeping alive these days, not just the cost of living, but just the cost of keeping alive. So I think that's something that we need to see. It's just going to be ongoing. Co-design and co-production are very much in words, David, and it's good to see the work that you've been doing there at Sacro. And sharing power, I love that. I love that phrase, sharing power too. And then the importance of strategy. Well, thank you, Caroline, for your point about the importance of strategy and planning and how that all fits into the frontline work and the families that we're trying to support as well. And developing resources and tools and sharing that stuff is great. I've got so many notes I've written down here. I'm probably never going to get through all of them. Co-location of advice was another one that I'd written here. Great to see services being developed in schools. Still a lot to learn from each other, and it's often events like this that allow us that thinking space, and that often does spark change. Local connecting of sectors and resources and information seems to be key to the effective programmes, and we still have some way to go to turn the tide. We have some pretty uncertain and difficult times ahead, but hearing speakers today like you folks has certainly filled me with a sense of optimism and hope. I hope it has for the rest of you, the stalwarts, the 36 of you who are still on the call. Funding and resources remain an ongoing issue when trying to effect change. So we posted in the chat there, the National Lottery Community Fund available funding. Steve, I think you were on the call as well today from the National Lottery from Moray area, which is very much about community action and fairer life chances. So worth a look at those. Please do share any innovative practice you've got with the Scottish Poverty and Inequality Research Unit, who have a really smart, if you haven't seen it, Tackling Poverty local directory. They're always looking for innovative practice as well. To also check the Scottish Poverty and Inequalities website for useful briefings and updates as well. And a final wee mention, I cannot do this, but forget to mention the Independent Food Aid Network's amazing leaflets. If you haven't got them, I think they're in 135 local authorities across Scotland, across the UK, Scotland, but in most of Scotland's local authorities as well. A huge thanks to all our speakers today. You've been amazing. I've learned so much, and thank you for your enthusiasm and support for the communities that you're working in. A big thanks to Mary McCallum and Mary Food Plus and Amanda for your IT expertise and support for today and pulling today's event together. I must also mention the very kind sponsors of today, Moray Golf Club. Thank you to Moray Golf Club. And also to those of you who've managed to stay on to the very end, and you're going to get away 4 minutes early. How good is that? So wishing you all a restful weekend and enjoy what's left of the evening. Thank you so much.
Thank you.
Thank you.
Thanks so much. Bye.
Thank you.